Okay. Building trust and long-term relationships between the patients and providers is most significant. Changing from a reactive system in which a sick patient seeks medical care to a proactive system that reaches out to patients through special events, written and broadcast communications, and telephone calls to keep them healthy or at least out of the hospitalized clinics, means a visionary healthcare system which elsewhere is already adopting South Central's techniques, usually after visits to Anchorage, to observe them in action. CARE Oregon, a small Medicaid managed care plan in Portland, sent not only its own people but also delegations from the clinics that serve its patients. It then paid the clinics a subsidy to get started and found that within 2 years, South Central's tactics greatly reduced the use of costly emergency departments and hospital admissions while improving health outcomes. Dr. David Lubbe, CARE Oregon's medical director, said in an email that the example set by South Central was hugely inspirational and remains the model that guides us. Similarly, Maxine Jones, the service manager of a primary care practice in the county of Fife, Scotland, is supervising a pilot study for the National Health Service using techniques adopted and handled by an integrated team of doctors and nurses by phone. I can see that this model has the potential to transform the face of primary care in Scotland, she said in an interview at the conference. Many other healthcare organizations in the United States and elsewhere have consulted with South Central on how to make their delivery of care more efficient and less costly while maintaining or improving quality. If enough of them summon the energy to transform their operations for their combined impact, it could help slow the rising curve of healthcare costs or even bend it downward. This is part of a continuing examination of ways to cut the costs of medical care while improving its quality. 6 decades after Israel's founding, its citizens remain deeply at odds over the future of their democracy. The latest illustration is the disintegration of Prime Minister Benjamin Netanyahu's new governing coalition after only 10 weeks. Mr. Netanyahu and his hard-line Likud party, supported by smaller right-wing parties, has had a majority in parliament since 2009. But when Shaul Movaz and his centrist Kadima party joined the government in May, the merger created a much broader coalition. It seemed to give Mr. Netanyahu, a disappointing, risk-averse leader, unprecedented authority to get things done. Mr. Movaz became deputy prime minister and outlined an encouraging agenda. The first priority would be integrating minority populations of ultra-Orthodox Jews and Israeli Arabs into the military and civilian service. The coalition would also revive peace negotiations with the Palestinians, pass a national budget, and enact electoral reforms. But the coalition quickly collapsed over the issue of military service, which has exacerbated tension between secular and religious Jews and with Arabs. Secular Israelis are increasingly resentful of the tendency of the ultra-Orthodox to refuse to serve and to separate themselves from the country's mainstream. The issue came up to a head after the Supreme Court invalidated a law that granted draft exemptions to thousands of religious students and mandated that it be rewritten by August 1st. To share the burden more equitably, Mr. Movaz proposed enlisting 80% of the ultra-Orthodox within 4 years, with stiff penalties for draft dodgers. Mr. Netanyahu sided with his right-wing allies and insisted on something more incremental. There was also talk of doubling army enlistment for Arabs. Israeli Palestinians are not required to join the army, and most of them do not. Many feel like second-class citizens and are deeply conflicted about their place in Israeli society. Demographic changes are making political compromise harder. Experts say an influx of Jews from the former Soviet Union and a high birth rate in the ultra-Orthodox community mean that many Israelis have a cultural mistrust of the democratic values on which the state was founded. $2:30.